He's the former president and publisher of the Sun Herald, and now he's on the radio. Welcome to Coast View with Ricky Matthews on SuperTalk Mississippi Gulf Coast 103.1.
Welcome to Coast View, the show that celebrates the men and women who are making coastal Mississippi a better place to live, work, and play. And somebody we're celebrating today is Dr. Nicholas Conger, a great friend of mine and a great friend to this show. He's been on several times, and he's an infectious disease doctor at Memorial Hospital. He's also an internist. He's in the thick of it, and he's a guy with a practical view toward the pandemic. Has had very important advice that he's given on a regular basis. And we're going to come back to all these points and kind of focus on it again. So how are you doing, Dr. Conger?
I'm good, Ricky. Thanks for asking. Hope you're doing well, too.
I'm doing great. Thank you very much. What I want to do today, I'm going to go to some headlines around the world and across America, some of the headlines in Mississippi. I'm going to do a new feature called My Facebook Feed. What's happening in social media, the kind of conversations that are happening. And I got a really smart friend of mine from France who I worked with in New Orleans, came into a conversation over the weekend and shared some really important points. We'll kind of break that down at some point during our conversation. But so sort of what's your general, thinking these days?
Well, certainly when we came out of kind of the lockdown mentality, I was hoping that we wouldn't have as many cases as we're having now. The cases are definitely higher than I had hoped. At the same time, though, I think that we're seeing a huge shift in demographics. So we're seeing a lot of young people catch it. And also, I do believe, I think someone had told me it just came out today. I hadn't had a chance to check it, but certainly my feeling has been that the viral strain right now, while more contagious, does seem to be a little less virulent. And so I think that is good news. I think that's the best news. We do tend to see viruses kind of attenuate themselves over time. I hope that would happen with this one. And so disappointed in the numbers, but pleasantly surprised in how the numbers are not translating into astronomical admission rates and deaths at this point. Now, that could change in the future, but at this point, that's the silver lining in this right now.
I think what we're seeing is that we may be doing a fairly good job of protecting the vulnerable still. And as these young people, and of course, that's, as you pointed out, the highest demographic right now in Mississippi is the age 18 to 29-year-olds. As they go back home and start, getting around their family members, maybe we'll see a change in it. Let's hope we don't. But more than likely we will. And the question is, just how significant will it be? So let's look at, on Monday, here are the 3-day totals for the coronavirus cases over the weekend. 2,130, bringing the state total number of cases since March 11th to 30,900. Sadly, the 3-day total over the weekend, the 3-day weekend total was 25 additional people died as a result of the virus. So it brings the total number of deaths to 1,111. And as we just pointed out, 18 to 29-year-old age group is seeing the highest number of confirmed cases. And then I should also point out that Sunday, Speaker of House Philip Gunn confirmed he tested positive after being in close proximity to another member of the House who also tested positive for coronavirus. So, it just shows it's a very infectious disease, isn't it?
Yeah, that's for sure. There's a study or an article that came out. Well, I shouldn't say articles. A lot of these things are coming out in the news before they actually make it into peer-reviewed journals. So, again, everything we say about this virus, it's new and it's changing. And sometimes these things that come out don't end up being true when they're peer-reviewed. But the gist of this was this M protein, which is a protein that correlates with contagiousness. There's a mutation in that has led to this increased contagiousness. And that seems to be affecting America more than any other country. But again, at the same time, the goal here is, or the hope is that it's a less virulent strain. And I think we're seeing a little bit of that. So, for example, if I can go on.
Yeah, sure.
For example, last couple of months, we were seeing 25 to 50 cases in our outpatient system with lots of testing a month. Last couple of weeks, we've been hitting 25 to 50 a day. So that's 10 to 30 times the number of cases. But our hospital is much busier, but the cases in the hospital have only doubled. So if we're seeing a 10 to 15 time increase in the number of cases in our outpatient setting, but only 2 times the increase of the hospitalization, that does give me some hope that there is less virulence here.
So let's get this out of the way. People still have the fallacy in their head that the reason we're seeing more positive is that we're doing more testing. But the reality is the percentage of positives to the total number of tests that are given has gone up. And that's just the fact, right?
Right. So yes, it is both though. It's not a total fallacy. We are testing a tremendous number of tests, and we are testing. See, the CDC a couple of weeks ago recommended testing asymptomatic exposures. We'd never done that before. So by increasing that testing, we are picking up a whole lot more asymptomatic people. So part of it is the increased testing. But like you say, there is clearly a lot more cases too. So it's both. It's increased cases and increased testing.
So here's a headline from the Washington Post. More than 200 scientists from over 30 countries are urging the World Health Organization to take more seriously the possibility of the airborne spread of novel coronavirus as the case numbers rise around the world and the surge occurs in the United States. So there seems to be a lot of conversation about, we always knew it was airborne, but there's a sense that it's going to linger longer. What's your latest thinking on that?
Right. So a little bit of background, if I have a minute. So when we talk about spread in the hospital, we talk about droplet spread. Droplets are larger things that, like, so if somebody sneezed next to you and you actually felt it hit your arm, that'd be a droplet. I have a surgical mask with me right here. These are, surgeons wear these so that their droplets don't go into the surgery bed when they're doing surgery. And so when we talk about droplet precautions, we're talking about that. In the medical field, when we say airborne precautions, we're talking about things that once they're coughed in the air, instead of falling down like a fluid-filled droplet, they just float in the air. And if they float for hours and hours and someone coughs over and over again, then you walk into that closed space, that room, then you can breathe it in because it didn't fall to the ground. My take on this is I do think that there's a possibility for airborne spread with this virus, that the World Health Organization, I don't know if they downplayed it, but they tend to not recommend airborne precautions because those masks are a whole lot more expensive than these plain surgical masks. And to put someone on airborne precautions is a much bigger deal, and it's very expensive. And the WHO, I think, is conscious of the limited budgets across the world, whereas the Centers for Disease Control always plays a more conservative role, and they always say, well, we're not sure, so let's do airborne. And it can be frustrating both ways, because if you do everybody in airborne precautions, that's a much bigger deal. That consumes a lot more PPE. So you don't want to do that if it's not necessary. But on the other side, if you ignore the fact that it can be airborne transmitted, then you might spread. Now, the summary is I think the airborne transmission is possible, but it's minimal, because our staff have been wearing these plain old surgical masks for many, many patients. And I know some patients have slipped through the system that we haven't diagnosed, and we are not seeing an increase in cases. So I think it's possible, but I don't think by any means that's a primary mode of transmission.
That's actually a really, really good point. I mean, you guys are the ultimate test tube every day around coronavirus patients, and you haven't seen a significant increase in the number of positives coming from your staff. That's actually probably one of the best indicators.
Right. Most of our staff that catch coronavirus are catching it out in the community, not at work, is my point there.
Yeah, what I always like to tell people, remind people, and let's do this real quick while we're on this subject, is that some people may actually be reticent, be hesitant to go to the hospital when they have a real need because they're afraid that they might catch the virus. But in fact, the hospital is probably one of the safest places to go, isn't it?
Yeah, that's right. Yeah, and that's a great point. We need to keep reiterating that. Again, we see people come in late stage of illness because they keep thinking, I don't want to catch coronavirus. I don't want to catch coronavirus. We see people who come in with, say, a foot infection that's so bad they need an amputation. But they wouldn't have needed an amputation if they came in a couple of weeks earlier and got treated. But they were so scared of catching coronavirus that these wounds just fester and stuff like that. So that's a great point. We're taking a lot of precautions. You're going to be exposed to minimum people in the hospital setting. It is very safe to come in and get routine care in a hospital.
Well, I've heard that, we've had Kent Nico a couple of times, the administrator for Memorial, as you know, and others on from other health facilities, and they all say the same thing: the extreme care that's underway to make sure that the general public, that the staff, that patients are all protected. is very significant. So again, let me just reiterate this, that if you have an issue that's not related to coronavirus and it needs medical attention, maybe it's an emergency room visit that you need to make, don't hesitate. Go. Get the care you need. Don't let your situation get worse because for some reason you believe that it was going to be unsafe to go. It's not unsafe to go. It's actually unsafe not to go. So please go. We keep having this like ongoing conversation, the politicization of the mask. Pretty amazing situation we've gotten ourselves into. When we come back, I want to zero in on a headline from the Guardian, and also want to share this social media feed conversation from over the weekend that comes back to the point that you keep making, and we'll make it very clear at the beginning of this next segment, your practical advice about the face mask. This is Dr. Nicholas Conger from Memorial at Gulfport, and we'll be back after this break.
Subscribe for free to the Coast View podcast on iTunes, Google Podcasts, Spotify, or wherever you get your podcasts.
Everyone knows the only thing better than pizza is free pizza, and right now, buy a $10 gift certificate to CiCi's Pizza for only $5. It's like buying a pizza and getting a pizza for free. Go to our station's website or Facebook. Look for the Half Off Deals logo to purchase this amazing deal right now.
If a muckety muck wants you to hear what they gotta say, they come here first and sit down with Gallo and JT. This is ground zero for all Mississippi muckety mucks. SuperTalk Mississippi. Watch your favorite SuperTalk shows in HD. Just go to supertalktv.com. Ever wonder what goes on in the studio during the shows? Now you can watch what happens in HD. SuperTalk TV, streaming now on supertalktv.com.
This is House Call for Health. There may be no greater medical mystery and no greater tragedy than sudden infant death syndrome. It used to be known as crib death. For no apparent reason, a presumably healthy sleeping baby dies. Medical experts don't have clear-cut answers to what causes sudden infant death, or SIDS, but now they have two risk factors: smoking and drinking during pregnancy beyond the first 3 months. A new study finds that babies whose mothers drank alcohol and smoked tobacco after the first trimester are at far greater risk of SIDS, 12 times greater. Previous studies showed a risk of smoking and drinking individually. This study says doing both drastically increases the danger. The research is sponsored by the National Institutes of Health, which is calling for greater publicity about the danger and improved screening at the very beginning of a pregnancy. For more health news, go to foxnewshealth.com. House Call for Health. I'm Lisa Brady, Fox News.
Hey, want to come work for the #1 radio group on the coast? TeleSouth Media has a great opportunity for an outside sales consultant. Get paid while having fun and work in the exciting, fast-paced world of radio. We have award-winning stations like 97.9 CPR Rocks, 105.9 The Monkey, G96.7, SuperTalk 103.1, and 103.5 The Possum. Take the first step towards a new and rewarding career. Submit your resume to Jesse at telesouth.com. That's JESSE at telesouth.com. TeleSouth Media is an equal employment opportunity employer.
If a muckety muck wants you to hear what they gotta say, they come here first and sit down with Gallo and JT. This is ground zero for all Mississippi muckety mucks. SuperTalk Mississippi. Watch your favorite SuperTalk shows in HD. Just go to supertalktv.com. Ever wonder what goes on in the studio during the shows? Now you can watch what happens in HD. SuperTalk TV, streaming now on supertalktv.com.
Be sure to go by this station's website and check out the half-off deals. Audubon Zoo tickets for just $15. That's half price. $30 zoo tickets for just $15. Again, go to this station's website or Facebook. Look for the half-off deals logo to purchase yours now.
Talking to the people that help make the coast such a unique place to live. This is Coast View with Ricky Matthews on SuperTalk Mississippi Gulf Coast 103.1.
Welcome back to Coast View. We have Dr. Nicholas Conger, an infectious disease internist at Memorial Hospital at Gulfport, and a real good friend to the show's pandemic, and he's given a lot of practical advice. So, Dr. Conger, let's go now to this headline from the Guardian, and it's going to zero us in on your most practical advice. So here it is. Another disconnect is at play here. Face mask deniers are so obsessed with their own personal liberty that they don't seem to realize that in reality, the scientific reality, they're infringing upon other people's liberty, in that by refusing to wear the face mask, they risk becoming coronavirus super spreaders, endangering the health of everybody that they meet, touch, and spray. Explain that.
Well, I do. I agree with the sentiment of that article. So there are lots of data that shows that people are asymptomatic, but spreading it several days before they start getting the fevers. And you just don't know if you fall into that category or not. And so those are the people who we need to wear masks. And so you will not know it's needed until after the fact. And we did talk a little bit about that airborne spread like a gas. And I told you, I think that's a minimal way this is spread. And then people are concentrating on the hand washing and the gloves. I think that is a minimal way this is spread. I think the most common way by far this virus is spread is by talking close to other people, especially indoors when there's not good airflow. And so, to me, my son told me, I didn't verify, but my son told me he saw something that said more people said they'd rather be ordered indoors than out with a mask. To me, that blows my mind. Like, why would you not want that? To me, your ticket to freedom is agreeing to wear a mask in indoor spaces, because I would much rather do that than have another stay-at-home order. And so my key is indoor spaces. You should wear a mask pretty much at all times, with a few exceptions. Like if there's a huge warehouse with lots of airflow and people are working 20 feet away, well, that's different. But indoors and outdoors when you're really crowded, if you're at rallies or protests or at a ball game or something like that, if there's crowding and you're sitting close to people, then I would wear one outdoors. But man, I think that's so important to decrease the spread of this virus. And again, a study, I think, mathematically said that mask wearing indoors would do the same thing as stay-at-home orders.
Yeah, well, there you go. You mentioned offline about you're concerned about mask fatigue, and that's a good point. In other words, if you're indoors, wear it. If you're outdoors and you're not in close proximity to other people, like if you go to the beach and you go with, as you and I have talked about in the past, with your family unit and you guys stay together, that's fine. But if you've got another family nearby that you don't know, and there's a possibility, and y'all end up having a conversation in close proximity to each other, you probably should put a mask on. But the key is just do social distancing when you're outdoors, and that's your best advice, isn't it?
Yeah, you see both sides. There's the mask deniers, which is a problem because they are helpful. And then you got the mask shamers that will, go up to somebody, walking their baby 20 yards away, or someone mowing their yard by themselves and scream at them and shame them for not wearing one. And those scenarios are extreme on both sides. Let's just be practical about it.
So let's do this. Oh, by the way, before I shift gears, I noticed someone inside their car the other day, by themselves in the car, wearing a mask. That's not necessary. But then you pointed out, if you're by yourself in a taxi cab, that's a different situation, isn't it?
Oh yeah. So just the thought. Just think about an enclosed space without good airflow. A car is a perfect example. That's why we worry about medical fields, because you have an exam room where someone may sit and cough in this room that doesn't have airflow. So just think, if you go in a situation and you realize there's a lot of people in this building and there's not a lot of good airflow, everyone needs to be wearing a mask, and just stick to that principle and you're good.
So this is my friend James O'Byrne, who I worked with in New Orleans. He's a multiple Pulitzer Prize winning writer and editor. And now he lives in France. So he's been in France for, I think, a couple of years now. Don't remember exact time frame, but obviously he's been there during the entire pandemic. And he said this, that as it relates to people wanting to blame the media for hysteria around the pandemic, here's what he says. I don't think you can blame this one on the media. The media aren't beating up retail workers who ask people to comply with mask requirements. That's an example of America, what he calls exceptionalism. In other words, for some reason, we got this a little bit better than maybe some of these other countries have it, or at least a handle on it. And that America is the only place where mask wearing has become political, that people react violently to being required to wear one. And then he goes on to talk about other things. But it is really unfortunate that we have found ourselves in a position where a mask has become political. That should be the most apolitical thing in the universe right now. Isn't that true?
Yeah, I completely agree with that. I don't have much to add to that. To me, wearing a mask or not wearing a mask doesn't show your allegiance to one party or the other.
The next point he makes is, and I'll just paraphrase it, he essentially says this, that some people are saying we didn't need to shut the economy down. And you and I have talked about this before. But to some extent, by reopening the economy and not using the tools at our disposal, like social distancing, hand washing, not touching our face, face mask, protecting the vulnerable, by not doing those things, we put at risk all the work that we did during the shutdown to get things under control and to understand what we were facing. I mean, the truth is we were facing a disease we needed to learn a lot more about. But at the end of the day, he contrasts that with what they did in Europe, where they're beginning to sort of reopen. And he makes the point that just about every country kind of messed it up in the beginning because we didn't really understand what we were dealing with. But then, some used the data and began to slowly reopen, and they've made adjustments to how they recover from the lockdown that they were in. But the truth is that in America we are in some respects kind of blowing it by reopening the economy and thinking that everything's fine because we could end up triggering some kind of a setback. And it's not too late, is it? It's not too late for people to pay attention and protect themselves, is it?
Yeah, so I've said all along, it's not when you reopen, it's how you reopen. That's more important than the when. A lot of the southern states and the warm weather states really didn't have the first wave, so they were kind of shut down and flattening a curve that was already flattened. So they really hadn't had their first wave. So as we reopened, I expected a little bit of a bump, again, not to this magnitude, but certainly, so how you come out of it is very important. And, and Americans love their freedom. That is absolutely true. and after that lockdown, getting that little bit of freedom, it is definitely spreading. But remember, the goal of the lockdown was so that we can get our act together with our testing, which by and large we have. There's starting to be some roadblocks now because we are testing so much, we're running out of supplies again. It was to get our therapeutics down, and I believe the therapeutics are better. We are treating patients better, and we've had much better outcomes in my hospital this month than we did 2 months ago. And then for hospitals to get their plans with the ventilators if they're needed. Actually, we're using ventilators much less, but the staffing and to have their coronavirus wards and all that. So the shutdown did allow us all of that. The goal right now is to not overwhelm the healthcare system while we open up. And again, if we opened up a little bit better with less cases, then that'd be a lot less likely. So we'll see what happens the next week or two there.
So here's James's next point, and this has to do with the focus on the death rate. People are, focused on death rate these days. And he says this: the focus on death rates for COVID-19 failed to miss an important point that is emerging about the virus. It does a lot of permanent damage, well documented in the medical research today. This is not the flu. It destroys lung tissue, damages organs, and leaves a host of recurring chronic health problems for many of all ages, including people we know who had it and recovered many months ago. Ask someone who hasn't had it and doesn't know someone who has, and that's a lot of people. And they'll say it only afflicts the old and vulnerable. But what doctors see is different, more insidious picture of a devastating and formidable foe that diminishes lives and can't be taken lightly. What's your thoughts about that?
I think that the jury is still out on the true chronic nature. I mean, we're talking a couple of months. I do think there are clearly people who do have some devastation from this disease. That may be a bit overstated, though. There are plenty of people who have had this and don't even know they've had it. And so there are clearly. So I think there's three groups. Obviously, there's a group that die from it. There's a group that have it and don't even know that they have it. And then there is going to be a group that has it and it is going to cause some long-term damage. So I agree with the sentiment, but I don't know if it's necessarily all that bleak for everyone who catches this virus. And, I do think we're going to find that there are two strains out there. And I think that we're going to find that the strain out there right now is the less virulent of the two. And again, I'm not downplaying it. I want our numbers to be better, clearly. But if there is this mutation that has allowed for increased spreading with decreased virulence, that would be good, even for those patients with the chronic damage going ahead.
And, and the last point he made is, and he called it sort of this insidious idea that it's only killing old people, and that for some reason that's okay. And that's really kind of an unfortunate side effect of all this, isn't it?
Yeah, obviously that's not okay. We, we mourn for every life lost. I agree with that. Although, this virus is very unique. Most viruses affect very young and the very old. This one really does only seem to but really affect the very old. So it is a unique virus, but I agree. Any death is an extra death we don't want.
Well, listen, it's been a pleasure, Dr. Conger, to talk to you again. We'll be back in touch with you in 2 or 3 weeks and see what the latest is. But, because we're learning something new every day, the headlines change literally every day. So I look forward to the next time we talk.
Thank you.
Listen live or on demand and watch episodes of Coast View on your laptop, desktop, or on your phone or tablet by going to SuperTalkMSGulfCoast.com.
Get out of the house and over to Big Play today. 2 massive arcades, bowling, go-karts, 2 mini golf courses, a 2-story state-of-the-art laser tag arena, bumper cars, and right now get a $50 game card for only $25. Visit our station's Facebook and print on demand so you can play at Big Play Entertainment Center now. These deals won't last long, so make sure you get your half-off deal. Big Play Entertainment Center, Highway 90 Biloxi. Bowl, play, eat. Go to our station's Facebook to get your half-off deal now.
Feeling down? Here's your prescription for a daily dose of good news and positive vibes. Good Things with Rebecca Turner. Every afternoon, Rebecca highlights all the good things happening right here in the state you call home. Daily exposure to Good Things with Rebecca Turner may cause smiling, feelings of positivity, happiness, and even laughter. When you experience these symptoms, tell your friends to listen. Okay. Weekdays starting at 2 p.m. here on SuperTalk Mississippi and now on Amazon Alexa devices.
Hey, I'm Steve Azar, and you never know who or what you'll hear when I spend a Mississippi Minute with my friends. We are with the fabulous Norbert Putnam, as he played on so many hit records, you can't count them, and produced for some of the biggest acts ever. Norbert, Elvis.
And I want to tell you about Presley. He had 2 different voices. He would sit and talk to me in a very calm, low voice. And we were at Stack's one night, and we were having lunch. We always had lunch at midnight because he was nocturnal. We sat there and we have our sandwiches, and at 1 o'clock, he looked up. He said, "Hey, Put, come on, it's time for me to go be Elvis." And he stood up, in a much deeper voice, he put on his macho voice. "Hey, fellas, it's 1 o'clock. Let's get cracking, okay?"
In a Mississippi Minute. Be sure to check out In a Mississippi Minute with me, Steve Azar, right here on SuperTalk Mississippi, Amazon Alexa, and now on iTunes, Google Play, and Stitcher.
This is House Call for Health. Medical researchers spend years developing drugs to treat cancer, but it's possible the next big cancer-fighting breakthrough could already be in your medicine cabinet. Scientists have long known that a drug for one ailment can sometimes be effective in treating something else. Aspirin is the most famous example. Researchers at Harvard, MIT, and the Dana-Farber Cancer Institute tested more than 4,500 existing medications. They found 48 drugs that killed at least some cancer cells. These drugs are for several different conditions, including diabetes, inflammation, and alcoholism. One drug is used for treating arthritis in dogs. Researchers in the journal Nature Cancer said the medications sometimes worked in different ways than mainstream cancer drugs. Now they hope these drugs can be further developed into true new weapons against cancer. For more health news, go to foxnewshealth.com. House Call for Health. I'm Lisa Brady, Fox News.
You could be spreading the coronavirus without realizing you have it, so do your part and stay home. It's important to limit in-person interaction with anyone outside of your immediate household, but phone and video chat are safe ways to connect. It's also important to limit social gatherings. If you need essential items like food and medicine, try using a delivery service. If you must leave your house for essential items, or if you want to take a walk for exercise, make sure to wear a cloth face covering. Stay at least 6 feet away from other people. Try not to touch frequently touched surfaces like light signals, street signs, or benches. And wash your hands with soap and water for at least 20 seconds as often as possible. This advice applies to people of any age, including teens and younger adults. It takes all of us to slow the spread of the coronavirus, so stay home unless absolutely necessary. Visit coronavirus.gov for the latest information.
Whether you're a Rebel, a Bulldog, a Golden Eagle, or just a sports fan, SuperTalk Mississippi has got a podcast for you. For you. Sports Talk Mississippi, the Rebel Report, Thunder and Lightning, the SuperTalk Eagle Hour, and the Borky Show are all now available for you. And it's all free. Get them all on demand at supertalk.fm and on your smartphone. Just search for SuperTalk on iTunes, Google Play, or anywhere you listen to podcasts.
What would happen if I had to pick up the phone, call 911 for one of my family members or one of my neighbors? What would I do if no one was on the other end to respond? What if there was no 911? So you can be a part of the solution.
Anybody can be a firefighter. Male, female, younger, older.
We have school teachers. We have leaders in business.
It's me, you, anyone that wants to be.
There is no typical firefighter.
What decisions are being made by state lawmakers, and how will they affect you, your family, and community? If you listen, you'll know. SuperTalk Mississippi, the SuperTalk app, and at supertalk.fm.
Hi, I'm Billy Kinder, host of Big Billy Kinder Outdoors here. The show Saturdays at 1, right here on SuperTalk Mississippi. Turkeys, whitetail, Grenada Lake crappie, or Gulfport redfish. We enjoy it all, especially when you're in camp with us on SuperTalk Mississippi.
He's the former president and publisher of the Sun Herald, and now he's on the radio. Welcome to Coast View with Ricky Matthews on SuperTalk Mississippi Gulf Coast 103.1.
Welcome back to Coast View. That was a terrific conversation with Dr. Nicholas Conger, the infectious disease internist from Memorial Hospital at Gulfport. If you missed it, you can go to our Facebook page, SuperTalk Gulf Coast, to hear sort of the latest on the coronavirus. And he's a great friend to the show and has such incredible up-to-date information. I think you'll enjoy seeing that. Now we're going to shift gears. We're going to move to the Chief Executive Officer of the Boys and Girls Club of the Gulf Coast, Keva Scott. Keva, how are you doing this morning?
I'm doing very good this morning, Ricky. How are you guys?
I'm doing really, really good. Thank you. So, look, I told you before we started the show that when I was president and publisher of the Sun Herald, any request that the Boys and Girls Club made of us, we always tried to help them with marketing or whatever it might be. And then, of course, I was also the chairman of the Knight Foundation, and the Knight Foundation has always been very supportive of the Boys and Girls Club as well. And I mean, you can't help but support this organization because you've been so incredibly focused on creating a safe environment for kids to be able to be engaged in incredible programs that can help them have brighter futures. And once you get your arms around that, people, they usually want to support it. Is that what you find?
Absolutely. Once we tell the story of the difference that the clubs are making inside of the lives of young people, for here, we tell the history. The Boys and Girls Clubs of the Gulf Coast was founded in 1966 by Senator Gillard, Ron Mary, and Bruce Stewart, who are all coastal natives and, great people in their own right, but came together to teach 15 boys how to box and to stay out of trouble, right? And that's what the club is doing to this day. Our national founding is the same type of founding. In Boston, there were young ladies, older ladies who were having tea in a shop. Little boys were out in the streets throwing coal through windows, they call them the Tinker Boys because they were going behind the railroad, getting the coal as they were putting coal on the railroads. Anyway, getting that coal, throwing it, just being boys, right? And these ladies gave up their tea shop so that kids would have a place to go and be safe. And learn other skills. And that's what the club does today. And so, we all want to get behind something like that, that is going to get kids redirected from something negative into something positive, right?
So one of the things I want to do, I want to talk about what's up at the Boys and Girls Club of the Gulf Coast today. But before we do that, I want to talk a little bit about your story. I mentioned to you that Ashley Edwards, the president and CEO of the Gulf Coast Business Council, said of you that you are a superstar. and he doesn't just lend that title to many people. So congratulations on that kind of recognition. But I think another reason you're a superstar is because of War Eagle.
War Eagle.
Keva went to Auburn University, and that's just between the two of us. My son Justin also went to Auburn. So for the Auburn fans out there, you know exactly what that means. But tell us a little bit about yourself, Keva.
Sure. So Ricky, I grew up in Mobile, Alabama. When it was a great opportunity for me to get closer to home when I accepted this position. Brought up, mom and dad, all of my family is from Mobile. And so my grandmother has family that was here on the coast. And so I grew up coming over to the coast, actually. So all of this whole stretch from Mobile to New Orleans is home for me. In our family, you had two choices for education once you were done with high school. You can go to HBCU or you can go to Auburn. That was it. And so, I decided to follow in my uncles. I had two uncles that had gone to Auburn and decided to follow in their footsteps and go to Auburn. And like I said, I was, an engineer when I got there. Those, grades sent me over to the business school where I, ultimately graduated with a business degree. And I loved it so much. I tell people all the time, I loved Auburn so much, I got 2 degrees. So I decided I'd go back and get another one. And so I had my EDS from Auburn. I was raised, in a Christian home. I tease people all the time. They were like, I was raised in church. I was like, no. I was really raised in church. We were in church all of the time, right? So we had, a strong moral compass that was rooted in the foundation of loving people, loving God, and loving your neighbor the way that you love yourself. And has that fed into my work and my choices for career? Absolutely. I got involved in Boys and Girls Club when I was at Auburn as a volunteer. And then I was offered a position that summer. This is a true story. I was offered a position that summer, and my unit director did not show up. And so the executive director at the time was like, listen, I just want you to kind of hold it down. I know you. I know you. Just watch it for me. Well, the next, that was that whole week. The next Monday, she came in and was like, well, you're the unit director now. Literally happened in the middle of summer. She's like, you're the unit director. And I'm like, oh, okay. And so there began, my work inside of Boys and Girls Club. But it started out a ministry that I was in. We were over there just volunteering and, tutoring with kids, getting to know kids, feeding kids. And then, I got this baptism by fire one summer where I was thrown in as a unit director. So fun.
So whatever that experience was, though, it really hooked you, and you decided that you're going to really dedicate your life, at least to this point in your life, to helping kids. Yeah. What about it hooked you, and what happened after that experience?
Sure. So it's the way that we open the conversation today, Ricky, being able to make a difference. I know every day that we leave here, children are better because we came to work today. I left Auburn and went to Regent University, as a matter of fact, in Virginia Beach to get my master's degree in organizational development. And while there, I wanted to do everything but work at the club. So I stayed away from it for years, went to Atlanta to do some work there for a while I was still in school, some internship work. And then when I got back, a friend of mine who also worked at the Boys and Girls Club there was like, hey, Keva, come with me. I just want you to look at this studio. And I'm like, I am not going over there because I know what the club does to you. I didn't want to be hooked back in. And so I'm like, nope, not going with you. I'm not going over there, period. And so one day we just happened to be out and she asked me to come and look at this music studio that they had put inside of the Boys and Girls Club. I went over there and, as they say, the rest is history. I got back involved in Boys and Girls Club while I was there in Virginia. Now, there was a time, Ricky, where I stepped away. Once I finished my master's degree, I wanted to go and make a whole lot of money and move far away to wherever and just, New York, Atlanta, and just do my thing. And I ended up working for a web globalization firm. It was 2000s or so, when they were turning your websites into different languages. And so I was having the time of my life working there. And a friend of mine, who is now a very close friend of mine, was like, hey, Keva, I'm having some problems, with my staff, my teen staff. I just want you to do one workshop for me, just one workshop. So I went over, I do this workshop, and then they offered me a program director's position, and the rest is history again. So I've had a good time with clubs. One of the things that has hooked me, Ricky, is I was a challenging kid growing up. My family, if you were to talk to my family, and ask, what was Keva like growing up? They would say she's just like she is right now, except, that doesn't show well when you're 9. That it doesn't come across well. They call all that good communication now, Ricky. They call it leadership now. They just called you a bad butt girl, when you were 9, 10 years old, and so it's, it's being a kid that was challenging, or at least, having people to tell me that I was, being able to communicate and deal with young people who this is a moment in time. This child is not going to always be whatever it is that you perceive them to be. This is a snapshot, this is a picture at who they are at 10. But if we can wrap services around them, if we can get the right people around them, we can pull the best out of that, and they can go on, and one day be your CEO.
Yeah,
although I challenging you in school.
It's so interesting hearing you talk about how when you came back to Auburn, you resisted going over there, because I understand so clearly what you're talking about. I did early in my career, I volunteered for the Harrison County Family Court Volunteer and Probation Program. And if they had a difficult situation, they would call me, and I couldn't say no, because I think once you look at the kids in the face and you understand how much they need someone to sort of be a mentor for them, once you see that, it's hard to say no. I mean, it's just hard. So you knew when you got over there and saw those kids' faces that you were going to have a hard time backing away from it. Yeah, that's the bottom line, isn't it?
Absolutely. Oh, absolutely. Absolutely. The work is rewarding. And one of, once I began to realize, I've never been one to really chase money anyway. It really was about purpose. And again, my worldview, my compass is, loving God with all your heart, mind, soul, and strength, and loving, others as you love yourself. So this is the work that ties into that for me.
Let's do this. This is Keva Scott, who's the executive director for the Boys and Girls Club of the Gulf Coast. We'll be back after this break, and we'll zero in on what kind of programs they're doing these days that are really making a difference. We'll be back after this break.
Hey, I'm Steve Azar, and you never know who or what you'll hear when I spend a Mississippi Minute with my friends. Talking to Paul Thorne, Mississippi true treasure, really incredible recording artist, singer, songwriter, has been doing it a long time, doing it the right way.
It's almost like a Forrest Gump thing, because I was a boxer, / I worked in a furniture factory, / I had a gig 2 nights a week playing my acoustic guitar in a pizza restaurant, / I was in the National Guard, and
wow.
All this stuff was going on at the same time. / I had a writing contract with Rick Hall and Fame.
In a Mississippi Minute. Be sure to check out In a Mississippi Minute with me, Steve Azar, right here on SuperTalk Mississippi, the SuperTalk Mississippi app, and now available on iTunes, Google Play, and Stitcher.
Hey, want to come work for the #1 radio group on the coast? TeleSouth Media has a great opportunity for an outside sales consultant. Get paid while having fun and work in the exciting, fast-paced world of radio. We have award-winning stations like 97.9 CPR Rocks, 105.9 The Monkey, G96.7, SuperTalk 103.1, and 103.5 The Possum. Take the first step towards a new and rewarding career. Submit your resume to Jesse@telesouth.com. That's JESSE@telesouth.com. TeleSouth Media is an equal employment opportunity employer.
If a muckety-muck wants you to hear what they gotta say, they come here first and sit down with Gallo and JT. This is ground zero for all Mississippi muckety-mucks. SuperTalk Mississippi. Watch your favorite SuperTalk shows in HD. Just go to supertalktv.com. Ever wonder what goes on in the studio during the shows? Now you can watch what happens in HD. SuperTalk TV, streaming now on supertalktv.com.
We know that we're asking Americans to do a lot right now. So we're asking everyone to be selfless for others so that we can protect those who are most susceptible to this virus.
A question I often get asked is, why should young people care about the spread of coronavirus? Well, we know that people with underlying medical conditions over the age of 60 are at highest risk, but they've got to get it from somebody.
Social distancing is really physical separation of people.
It's what we refer to when we ask people to stay at least 6 feet apart.
Not going to bars, not going to restaurants, not going to theaters where there are a lot of people. It all just means physical separation so that you have a space between you and others who might actually be infected or infect you.
We all have a role to play in preventing person-to-person spread of this disease, which can be deadly for vulnerable groups. For more information on how you can social distance, please go to coronavirus.gov.
Thousands of Bulldog fans have subscribed to the Thunder and Lightning podcast. Have you? On each episode, Brian Haydad and Joel Coleman give you an inside look at your Mississippi State Bulldogs. The Thunder and Lightning podcast is free and available on demand at supertalk.fm and on your smartphone. Just search for Thunder and Lightning on iTunes, Google Play, or anywhere you listen to podcasts. Thunder and Lightning from SuperTalk, Mississippi, covering the Bulldogs like no one else.
Be sure to go by this station's website and check out the half-off deals. Audubon Zoo tickets for just $15. That's half price. $30 zoo tickets for just $15. Again, go to this station's website or Facebook. Look for the half-off deals logo to purchase yours now.
Talking to the people that help make the coast such a unique place to live. This is Coast View with Ricky Matthews on SuperTalk Mississippi Gulf Coast 103.1.
Welcome back to Coast View. We have Keva Scott here, who is the Executive Director for the Boys and Girls Club of the Gulf Coast. And Keva, one of the things that I bet makes what you do so rewarding is that over the years, whether you go back to your time in Auburn or Opelika or wherever it might have been in the United States, and of course your time going on 5 years here on the Mississippi Gulf Coast, the thing that probably hooks you is when you see kids that in some cases really have the deck stacked against them come into your program and literally have their lives change. And they've gone on to be CEOs and doctors and lawyers. I bet you have some amazing success stories.
Absolutely, Ricky. You know, I've been in Boys and Girls Club work for 24 years, and I can't believe it's been that long. But, you know, I've had, young people come, for some situations that we can only dream about or imagine, or we, have just seen on TV. And those kids are, have graduated from the military. I have people contact me on Facebook, and we're just little tykes when we met. And they'll have to jog my memory on who they are, and say, if it weren't for you, if it wasn't for the Boys and Girls Club, in our families, like we've had families here on the coast, we've had families change. We've had parents be able to go back to school and reimagine their entire family unit in a way that would not have been possible if there wasn't a safe place for their children to be so that they could get back in school. The Boys and Girls Clubs of the Gulf Coast, I really want our community to be proud. We are, state leaders in terms of Youth of the Year. And that's a young person that has fought their way through seemingly insurmountable odds to be able to go on and beat out the entire state of Mississippi. There are 20 other organizations like ours, throughout the state. But these young people got out of school and they submitted themselves to more structure, right? Get out of school and you come up in here because it's not loosey-goosey in our clubs. And then they came in and they did community service. And some kids have gotten their first jobs. We have a program called Junior Staff where we teach you the soft skills, but then also hard skills. We provide opportunity for you. We like to, if there's a young person that's interested in having a podcast or being on the radio, we'd like to partner them with you guys to create opportunity for them to realize what their dreams are and then go on, and build that dream out for themselves. Jarvis McInnes, who we just had on our fundraiser, Jarvis grew up right over there in the Turnkey. Jarvis is now in Columbia. He's doing, he's on sabbatical now, but Jarvis went on to Tougaloo and then went to Princeton, was a professor at Notre Dame, and he is now at University of North Carolina, doing work. And then there are those that, Ricky, have just gone and become good men and women who pay their taxes, who lead their families, who, are contributors in a positive way to their community, but had the deck stacked against them and people thinking that they could never be or become. And all they needed was space. All they needed was a place to go. Go ahead. I'm sorry.
Well, I was going to say, Keva, in the short time we have left, hit real quick, what are the various programs? And what we'll do the next time we come back is we'll start to really zero in on each one of them. And we'll have you back more times than an additional time so we can really zero in on that. But why don't you kind of cover what are the big headlines of involvement that you guys have?
Sure. So one of the things that I'll talk about is we have a literacy project that's going on right now, and that's actually with Disney. We have been working with Disney over the past 2 years, and they have been connecting us with Disney stars. And so our young people are actually Skyping with these stars. So there was Quvonjanae Wallace, who was in Jamie Foxx's adaptation of Annie. As an example. We have studios inside of our clubs now. They're called Makerspace Studios, where we are teaching young people STEAM, science, technology, engineering, arts, and math. They are learning everything from t-shirt making to robotics, to making circuit boards, and the whole gamut. And so we have a team. When we shut down, that team actually began to do some of this work virtually. So we have a YouTube channel where, we're limited on the amount of kids that can come in the club, but they can certainly still get those daily lessons through YouTube and also virtually. And then we have programs for boys. We have a mentoring program that's just for boys, that people, if they are looking for an opportunity to give back or if they want to become mentors, they can certainly volunteer to work with our young boys in this program. And then we have a mentoring program for girls. What I always say about us, Ricky, that the beauty is that we're comprehensive. The stress is that we're comprehensive,
Right,
but we
right.
Dynamic sports program as well. We have everything. Our moniker is, whatever it takes to build great futures. And so whatever it is that a young person needs, that is within our power to make happen for them, we certainly will help to create that.
And I think one of the most important things is they have this opportunity to come to a place, consistently come to a place that is safe and that has people there who care about them. I love the fact, and we'll talk about this the next time we get together, it's an opportunity for kids to discover themselves. Do they want to go in the direction of a trade? Do they want to become a rocket scientist? How, as they begin to really flex their, intellectual muscles, they discover themselves. So it's a great opportunity for this community to have such a great place in the Boys and Girls Club. And I really appreciate your leadership. We're kind of out of time now, Keva, but what we'll do, we'll have you back in about 3 or 4 weeks, and we're going to really zero in and learn more about the Girls and Boys Club. It's been a pleasure to spend some time with you.
Absolutely. Same to you. Thank you for having me, Ricky. I appreciate it.